Good evening and welcome to the August 18th, 2025 Grafton Board of Health meeting. As a preliminary matter, this is Jen Maynard, Chair of the Board of Health.
Sorry, it's August 13th.
It's August 13th, thank you. August 13th, 2025 Grafton Board of Health meeting. As a preliminary matter, still Jen Maynard, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Andrew Chalupka.
Aye. Here.
Welcome. Karen Gostowski-Galvin.
Karen Gwiazdowski-Govin here.
I'm going to stop changing how I pronounce your name one day, I'm sure. Bill Muller.
Bill Muller here.
Radhika Prabhu.
Radhika Prabhu here.
And staff and anticipated speakers on the agenda. When I call your name, please respond in the affirmative. Nancy Connors. Nancy Connors, can you still hear us?
She's across the hall, right?
Yep.
I'm going to text her. She might have stepped away. But she's here. I'd like to open the meeting. May I have a motion to open the meeting?
This is Andrew Chalupka. I make a motion to open the meeting.
Is there a second?
This is Bill Muller. I second that motion.
All in favor? Roll
Andrew
call.
Chalupka, aye.
Bill Muller, aye.
Karen Gwiazdowski-Govin, aye.
Radhika Prabhu, aye.
Jen Maynard, aye. This open meeting of the Grafton Board of Health is being conducted in a hybrid fashion consistent with the Act extending certain COVID-19 measures adopted during the state of emergency. Governor Healy has further extended this act until June 30th, 2027 of the remote meeting provisions of former Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of COVID-19 virus, the Act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted on the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. If the public has a question or comment on the agenda item, please utilize the Q&A feature in Zoom. Please include your full name and address when submitting a comment. For this meeting, as we said, we are hybrid, as indicated on the town's website identifying how the public may join. Please note that this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and take care not to share your screen. Anything you broadcast may be captured by the recording. Any supporting materials that have been provided to members of this body are available on the town's website unless I otherwise note. The public is encouraged to follow along using the posted agenda unless also otherwise noted. Before we turn to the first item on the agenda, permit me to cover some ground rules for effective and clear conduct of our business and ensure accurate meeting minutes. I'll introduce any speakers on the agenda for a topic. After they conclude their remarks, I'll invite the board members to provide any comment, questions, or motions. Please identify yourself by name when speaking. Further, please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly and in a way that helps generate accurate meeting minutes. For any response, please wait until I yield the floor to you and state your name before speaking. If members wish to engage with other members, please do so through me, taking care to identify yourself. Finally, any votes on any motions made during this meeting will be conducted by a roll call vote. Whew. All right. All right, let's kick it off. So I just wanted to go through, before we do flu, RSV, and COVID updates. They are not on the meeting today, but we do have some staff members that are starting to join the regional public health group that we are joining with Shrewsbury and West Boylston. They do now have a regional health director, Annette Garcia, a health inspector, Mackenzie Faulkner, and starting tomorrow, regional health nurse, Bridget Hurley. So I know that we'll maybe talk a little bit about that tonight. There was a meeting today to connect with them, and we'll be connecting with them in the coming weeks as things progress. But just wanted to give that update as we did give some presentations yesterday, and more things have come to light even since yesterday. So anything to add there to start?
About the collaborative?
Yeah, about the collaborative or any staff members. I know we are in the process of meeting folks.
Right. Well, I did attend their meeting today in Shrewsbury along with Nancy, and I think they're making good progress. I think there was a sense that the association with the Worcester Department of Public Health had not continued to be as valuable as it had been in the past. There were some who had been involved prior to 5 years ago that commented on things that were much more effective prior to the COVID outbreak, and it seemed like much of that was lost, partly through retirement and loss of different personnel. I do believe that they have a good plan. I do believe they've made good progress in terms of recruitment. I think it will require some degree of interaction with the other two towns as well. And I think that's one of the things that we hadn't had much of recently. But I am optimistic that this will achieve our goals and move us forward.
Great. Yeah, and I think as more meetings kind of come up, I was mentioning to Nancy, I'll certainly try to avail myself so we can also, because we had at least recently, I think since some of, well, we're all pretty new to the board except for Karen, what processes and things we did start to really get back in, like with the Alliance, seeing, if other towns were doing that, is that something they're interested in, and what's a reasonable timeline to get some of those things going, so we can kind of restore some of the things we had built as well. So we'll work through that, and then certainly be a great opportunity to connect with the staff, understand some of their backgrounds and what support we might need to provide as they're also onboarding, as we said yesterday, as we're flying and building at the same time right now. Great. Well, thank you for attending and the update. So we have been getting the flu, RSV, and COVID updates. I think we'd seen a slight uptick in some of the COVID numbers recently. Others, please weigh in if I'm misrepresenting the data. And Nancy, we are posting that information on our website, at least for right now, right? Go ahead, Karen.
I'm pretty sure, I don't know if Nancy can hear us. Last I knew we were still posting it. But yeah, definitely I can speak knowledge personally of folks that have, COVID is still around and kicking. Let's just leave it at that. Definitely know some people recently that have had COVID. Thankfully, everyone had mild cases that I'm aware of. But yeah, and then there's still because I know other people who have some type of respiratory thing going on, not tied to like the wildfire smoke. Because I know some people have had issues with the wildfire smoke coming through also, but it's what others have had that's not COVID, it's not flu A, and it's not flu B. So there's definitely some stuff still floating around, even though it's the summer. So just typical precautions for folks that it's not the, middle of the winter where we all think these are like the height of the season. Yes, the numbers aren't horrible like you might find in like your winter back in the day when COVID first showed up, but it's definitely still out there. So you can't guarantee you're going to avoid it.
And sure, of course, I believe we're just about 2 weeks away from the kids returning to school, and usually we see some uptick around more of the colonies being together, if we say, especially in the younger groups. So we'll continue to post those. Similarly, we've been posting tick and mosquito updates Folks probably saw on our social media and our website that we did have a positive sample with West Nile, right? In part of Grafton, so there was some additional spraying completed. We have not seen positive samples come through since. Certainly getting alerts from other parts of Massachusetts. Obviously, they travel. But definitely been a high tick and mosquito activity season is what we've been seeing. Anything to add, members? And just to note, I believe folks can opt out if they want of spraying in their area and see where the activity is going to be. But for the most part, we're not doing that actively unless scenarios pop up. Opioid settlement fund updates. Anything to share, Bill?
We did have a meeting yesterday. We had active participation by the people from GAP. The acronym stands for Guided Addiction Access Point Recovery. The two primary people are Matt Gear and John Marhefka. They're both recovering narcotics users, and I think have a great deal of experience in terms of counseling and educating people in terms of narcotic and other substance abuse issues. We are funding them from our opiate settlement funds. We anticipate receiving additional funds over the next decade of over $1 million. And there may be some additional sources of those funds that will be forthcoming as well. So I think we've made much more progress than many communities have.
Yeah.
Certainly the fact that GAP already had a presence in our community was very helpful in terms of getting this up and running. And Dan Finn continues to lead our effort in that regard. I also did attend a conference of the PEP. PEP stands for Public Health Emergency Preparedness. There's 70 plus communities in central Massachusetts who are part of this. It's funded by the state. They did tell us that there's a deadline for applications for funding of various things.
Yep.
And Andrew had mentioned perhaps some cardio defibrillators and things of that sort. There's a 30-page syllabus regarding that. But you know, it was interesting to see some of these things. I think had been we'd been represented by the coalition from Worcester, and now we're representing ourselves, and we're coming up to speed in terms of what some of these resources are.
Yeah, absolutely. Just a quick follow-up on the opioid settlement group there. For the grant, were we replacing funding that they had lost, or are they hoping to add certain number of services? How have they?
Actually, as it turned out, we were replacing funding that they were getting from the district attorney's office.
Oh, okay, great, yeah.
So it was a fortuitous event that they were in the process of losing some funding that they had, and that we were in the process of looking for meritorious people that we could function or fund. And I think it worked out to our advantage and to theirs.
Great. Yeah, I think we may have talked about that. I just couldn't recall how it was. That's great. So we could maintain the service level that they were receiving. Excellent.
Andrew, do you have anything to add?
Well, just that yesterday, we also had representatives from several sheriff's offices who were seeking funding
Oh,
for scholarships for sober living, because the state, my understanding of it, the state funding was insufficient. So they are soliciting opioid settlement funding from individual towns. And we requested additional information, specifically which municipalities have done this, how much have they given, and would this be a short-term or a long-term expectation of funding, from our opioid settlement funds. And so they're going to get back to us with additional information.
There are people from Middlesex County, Worcester County, and Suffolk County, I think.
Yeah, and it wasn't really clear if our money would be used for Grafton residents
Well,
seeking
right.
sober living,
Yeah.
or people in
Which
Middlesex.
would be our intent, obviously.
Yeah,
sure, yeah.
yeah, we didn't commit to anything. I pointed out that it was, sort of the reverse of what I was used to, going to individual municipalities and asking them to give money to the state. So more to come on that.
Yeah, interesting. So, because like all communities are getting these funds, right?
Yes.
So have they approached their own groups? Or do they not? Are they not as?
I'm sure they're approaching anyone who
Yeah,
has
that's-
available funds.
Probably.
Um,
That makes sense. Yeah.
My sense was that it was primarily to service people who came from our area.
Oh, okay. Yeah.
But clearly that would need to be determined
Yeah.
because obviously it was for the benefit of our local people, and I
Right.
think we have sufficient opportunity to help people in our area too.
Yeah, but I can also understand in the event they get sent somewhere else because there isn't an offering available, but we'd need a mechanism to make sure, and if they have any data about who they may have served from our community, it would be helpful for sure.
Yep.
Great.
I'm sure they'll be back.
I'm sure. Great. Well, eventful. It's been an eventful couple weeks.
Yeah, a couple days. Actually.
Yeah, no kidding.
Oh, and one additional thing for the PEP, so
Yeah.
we are eligible for a first aid kit and a defibrillator for our emergency dispensing site. I do not know.
I don't think we have an
Grafton
emergency
has.
dispensing site.
We can create one.
Well, I mean, we would need to by August 22nd,
Yeah,
as Bill
that's-
pointed out, so that's,
Say more about emergency dispensing site.
that I don't know.
Yeah, so we'll find out what that is and if it is worthwhile for us to create it. So I had asked Andrew to follow up with these folks because there's some funding around. Nancy, go ahead.
Oh,
I do recall speaking with the girls in Worcester, and I ordered a defibrillator and a first aid kit. And now we're not with them anymore, so I don't know where it stands.
Oh.
But they just can't leave you hanging. I don't know. Because they cover all the communities.
yeah. And
I can check on that.
Yeah, that'd be great.
thank you, Nancy.
Because
Okay.
if they've already given them giving one to us, they might not, and we want to obviously get that if it's already been purchased on our behalf. But there's some funding for in particular, it looked more so on communication modalities in the event of an emergency, like walkie-talkies and phones and stuff like that. But I had asked Andrew to ask if are there other funding mechanisms like how we had during COVID. They supplied a lot of the masks and all those things. So we'll continue to explore if there are any other additional sources through them, or if they know of any resources, even opportunities for us to leverage. Because we'll get to, we're at ambulance. We'll talk about ambulance committee next. So as I mentioned briefly on the select board meeting, we've been a little bit in a pause just because we've been trying to cover a lot of the Board of Health members have been sitting on additional things that we previously don't because we had an alliance before, and we're building a new alliance. but our goal is to draft a proposal for Evan on what kind of funding. We do have some information from the fire department in particular, who has a good system in place on what it costs to sort of have a centralized contract, and make recommendations to Evan around kind of housing that all in one place, a centralized location. And, you know, he's obviously going to need a cost, and if there's any opportunities for us to do grants or defray the cost of some of those things, like through PEP, not FIP, apparently, we want to make sure that we're outlining those for him. So that's when I return from my break at the beginning of September, I will get that drafted. That's where we're trying to get some information. The other piece of our ambulance committee is just that, ambulance response services. So Todd is here with us today, and we had started to get together a list. We met with Greg, yes, from the ambulance group, and we have a list of housing locations in particular that we think would benefit from some education about when to call 911 and when maybe those things could be addressed in other ways. Our response times in Grafton are actually quite good, but always can do better, especially where we are in a mutual aid situation where they might be responding from another community. So we're going to set up some meetings with those locations and also see if we can put some interventions in place, like a brochure for did we say the ambulance to be able to give to people if they're noticing sort of frequent flyers and that maybe they need some additional supports at home that they're not getting, and maybe they're not connected with like the senior center, for example, or appropriate health coverage, or in-home supports that could possibly help reduce their need to kind of go out, lift assist and things like that. Anything to add?
It's complicated.
It's all very complicated and a lot of work streams, but we think, you know, even if we do some of these, you know, the centralized kind of contract, we found that a lot of groups like the schools and public buildings have some variation of emergency response, but not a consistent sort of centralized way of doing that. And of course, you know, certain groups kind of have to have those things, but you know, areas where people are congregating in large numbers, like the schools and some of our public buildings, we want to just make sure that we have, again, the right levers in place so that people can get help as quickly as they need it and have the best outcomes possible. And then for the ambulance, of course, same, you know, anything that we can reduce time and save money for the town is obviously top of mind.
So I've been having to write the emergency services plan for the town that deals with addressing the emergency medical services before the ambulance arrives.
Yeah.
And the state did their initial review and sent it back to me and asked me to start investigating some private sector businesses because some of them are regulated by the state, and so they want to know how they are doing things.
Yep.
So if they're licensed through the state, then I have to go investigate it. So I've been looking at the private schools, looking at some of the entertainment venues, and finding out what they have. And so far, AEDs are not around as much, maybe as they
More
should be.
private places.
Yeah, and but there's a great interest to have them, and there's a great interest to have Narcan.
Yeah, yeah.
Around and have the training.
Yeah.
So even at the private sector. So I was wondering if, since we have a stash of Narcan, can the private sector make an appeal to the Board of Health to access some of that if they can't afford it, or?
I think, Nancy, the Narcan is available to anyone in the community, right?
Yes.
Okay, so I can make that endorsement?
Yes.
Okay.
Yes, for
Okay.
sure. And I believe we have access to be able to order what we need. So again, if it's serving people in the community, then we absolutely have a way to get access to that. Right, Nancy?
Yes, that's correct.
She's got it. That was, okay. One.
Great, okay.
One thing,
So
Todd.
this is an ongoing thing, and I looked at the data for January through July for the ambulance calls, and it's pretty much we're starting to see a tick increasing.
Yeah.
So this is a public health issue.
Sure, for sure. I just want to point out, this is, you know, some of the themes that, and we've talked about this in our meetings, that we see in, you know, some housing and people not necessarily having all the connections to the support services. This is not an issue that is a Grafton only issue. This is statewide. There are commissions on this actively working on how to better connect, you know, people that maybe are in public housing or even their private housing, with making sure that their environment is safe and accommodates what their needs are as their needs change. So it's great that we're, you know, trying to work on these things, but as you said, it's complicated. There's lots of layers and steps and people to connect with. So
Yeah.
but we're having the conversation and trying to move these things forward is the first step. So
Do you have plans for the next meeting for the subcommittee?
I think what we'll probably try and do is see if we can get those housing stakeholders together, like we talked about. And I want to get that stuff off to Evan and then see what we get for some responses. And that's probably a good next meeting to have, so we can probably report back some of the feedback we received from
Okay.
folks. Does that make sense?
Yep.
Cool. All right. So after September 3rd.
We have a hand up.
Adika.
A quick question. I know this is Grafton Board of Health, so it might sound a little stupid for the question, but with regards to the private businesses that you were talking about for emergency preparedness with the AED and Narcan, that is for the town of Grafton only, or are you looking at?
Town of Grafton only.
Yeah.
Okay, thanks.
Our newest board member. We've had a lot of changes, Todd. I told you. Great. That's a good question. Yeah. We don't have the same emergency plan, Radhika, so you know, and others that some communities have, and Todd has been diligently working on that and identifying areas that he needs some help with, and it felt like the Board of Health was the right place to try and step in, even if we don't have control over everything. Great. All right. Moving on to voting of the MHOA as our tobacco agent, as we need one for inspections and for consideration as different rules and regulations change. Would anybody like to make a motion?
What is MHOA?
Oh gosh, you'd
stand
ask
for?
me that acronym. I see your list of acronyms over there.
Could be,
It's give me 1 second. I have it right here. Nancy and I, we've got so many of them going back and forth on stuff. Go ahead, Nancy. Do you know it off the top of your head?
Massachusetts Health Officers Association.
MHOA.
I move that we name the MHOA as the tobacco agent for the town of Grafton.
Second.
I second that motion.
Roll call.
Andrew Chalupka, aye.
Bill Muller, aye.
Karen Gwiazdowski, Govan, aye.
Radhika Prabhu, I.
Jen Maynard, aye. Great. Okay, and then our next item is the 2026 meeting schedule. Gee, everyone wants us to talk about 2026. My goodness. Do we want to just do? Well, I guess do we want to talk about first? Do we want to do? Let's just talk about Q1. And do we want to do? I know we've been trying to do hybrid. Do we want to try and keep hybrid January through March, or do you all want to do remote, or what are your thoughts? For discussion.
Maybe that's the time to try remote.
You want to try some remote for that time period?
I'm usually gonna be remote regardless, just with work and stuff, not necessarily by the time meetings typically end, it's not enough time to get to the town hall, the municipal center in time. And yeah, agreed, the winter months aren't necessarily a bad time to aim for full remote if the group wants to.
Yeah, and I think we are permitted for that. I think our plan was to go through at least summer. So let's talk about September 8th. Do we want to do hybrid meeting for that? For this year?
I can be present for that meeting.
Hybrid.
I can as well.
Me too.
I can be as well.
Great. October 6th, do we want to do hybrid or virtual?
I can be present for that meeting.
I can as well.
I can as well. Hybrid. November 10th, 2025. Is that where we want to maybe start virtual? Through March?
Sure.
Sure.
There we go. I won't ask you every month now. Virtual, November through March, and then let's align on January, February, March dates. Either January 5th or January 12th.
Well, will work better for me.
12th works better? Let's do the 12th. That'll get us away from the holiday in case anybody wants to get away from the snow. February. Oh my goodness. 9th? Does that work for folks?
Yes.
Yep.
Yeah.
And March 9th? Or the 16th?
Either one works for me.
All right, let's put it for March 9th. I'm looking, I'm like, yes. So far, looks like that works. I'm muffled. Sorry, Nancy. So that's hybrid through October, virtual starting in November. We have our dates through 2025 listed on the agenda. And then our dates for 2026 Q1 will be January 12th, February 9th, and March 9th. Thank you. We have one set of meeting minutes to vote on. January 2nd, June 2nd, 2025 meeting minutes.
No, you do not have
I
those.
don't. I lied. I didn't lie. It's on my agenda.
It's on the agenda.
Skip. New business. We talked about the PEP service stuff, right? Andrew, did you want to talk about dementia friendly?
Yeah. So there was an initiative in town that I thought was wonderful that I recently became aware of, and I just wanted to publicize it given its importance. And I want to recognize the hard work that led to this initiative. So Grafton has been officially certified as a dementia-friendly town, and this was spearheaded by a Grafton resident who's a public health nurse and a current doctoral student, and her name is Helen Gannis. And to quote from the Dementia Friendly Grafton brochure, Dementia Friendly Grafton works to ensure individuals living with dementia and those who care for them feel supported and included. This initiative focuses on, first, educating the community to reduce stigma and build understanding. Second, improving access to services and dementia-friendly spaces. And third, fostering partnerships with local organizations and leaders. And fourth, encouraging social connection and meaningful engagement for all. And they noted that there are estimated to be almost 300 residents in Grafton living with dementia. So I'd encourage anyone who wants to find out more about the initiative to look on the Council on Aging's website. They have a page on the Dementia Friendly Grafton initiative with a lot more information. And finally, I'd like to make a motion that the Board of Health recognize Helen Gannis for her work and her efforts in making Grafton an officially dementia-friendly town.
How shall we recognize her? Just acknowledging her work?
Well, and and we'll send her a letter too.
Sure, yeah, we can. Second,
I second that.
roll call?
Andrew Chalupka, aye.
Bill Muller, aye.
Karen Gosowski.
Radhika Prabhu.
Jen Maynard, aye. Great. thank you for bringing that to us, Andrew. For people that don't know, the older adult population is the fastest growing population nationally and in Massachusetts, and we're actually all aging as we speak. So it's really important to have inclusive communities, and that is something that a lot of big cities are doing, and so it's great that our community has recognized that and done that work. And I think it aligns well too with some of the work that we need to do on our committee as well. And again, really just making sure people have what they need, know how to be connected, feel connected to their communities. It's very easy for folks to be isolated as, you know, maybe their family and friends pass away or move away from their communities. And
Yeah, this is what this is what those care programs
Yeah.
through public health vehicles can go out and visit and
for
help.
sure, yeah.
Yeah, and drive 911 calls down significantly.
That's good. It's good for the individuals, but good for the whole
whole
healthcare and
system.
social system
Yeah,
for sure.
ERs.
Yeah, absolutely.
Yeah.
All good things. Great. Let's see. And then we do have some mail and correspondence to read and acknowledge. Oh,
I have some new business.
you have new business. Go
Yeah.
ahead.
May I?
Shh, I don't know.
So I have another role. It's as the Deputy Director for Emergency Management.
Wow. Congratulations.
Thanks. So I am concerned about Crescent Manor. And I've discussed it with my director, and she says that probably at this point, this issue should be directed to the Board of Health to see if you all can help with this situation. So in light of the Fall River disaster, we wanted to maybe consider approaching Crescent Manor to ask about emergency evacuation plans or any emergency action plans that they have in place. And if that's something that we can do or promote or talk about or open discussions with the facility.
So they would be, as a rest home, regulated by DPH.
They are, yeah.
And so I think if we have specific concerns, that is their
Purview.
well, that's their licensing body
Right.
and regulatory body.
Right.
Additionally, individuals residing in rest homes and assisted livings and nursing homes have access to an ombudsperson.
Mm-hmm.
So I think that we probably should, if we have specific concerns, then maybe we reach out to those entities. There are some limitations to what the Board of Health can do with stepping in, but those are the folks that have regulatory oversight for them. So I don't know if we can be supportive in trying to provide those contacts, I would say, but I don't know if there's a specific area, like they're understanding their emergency protocol is probably not necessarily something right under us at this point.
Mm-hmm.
Does that make sense?
It does, and that's why even this is questionable for the Emergency Management Agency,
yeah.
whose role is to prepare the
Yeah.
town,
Yeah.
the entire town, even private citizens.
Yeah.
We can't step in and force anybody to do anything.
Right. But if there are, existing concerns, they have definitely regulations that could speak to that as well. And then certainly if we start to lay in additional things, I don't know that we have the foundation set up here yet to be able to say, okay, well, we have these policies set forth here in Grafton for doing business or what have you. I don't know that we're there yet. Aside from some of the things that we have addressed with them that are under like our inspector roles.
Mm-hmm.
So your deputy role is with which entity?
Emergency Management,
Is that like is that state agency or
Grafton's
or
agency.
Grafton's agency.
Yeah.
Awesome. Well, I envision us doing much more work together then, Todd, huh? So yeah, let us know if I can probably help connect you with some of those folks.
DPH, okay.
yeah.
Okay. The goal would be to prevent anything from
yeah.
happening.
Yeah.
Even, having the fire department be able to better understand the layout so they can assist, because a lot of the problems were with the fire and fire was egress.
Yeah.
So,
Yeah, and again, I think the governing bodies over assisted living is actually governed outside of a different group
they are. Yeah.
than DPH. But that group is the ones kind of taking the lead on some of that. So, yeah, good.
Very good.
All right, thank you. All right, so some correspondence, just acknowledging on, this is not directly, addressed to the Board of Health, but there was, in the, portal, a study regarding pump testing received from Philip Zarillo on 7/15. And then we did receive a subsequent letter on 7/30 from Mr. Zarillo, that is addressed to the Board of Health, so I'll go ahead and read that as.
Ceriello.
I'm sorry, Zariello. Not one of my strong suits is pronunciation of people's names, clearly. Okay, Board of Health, Town of Grafton. I'm writing for several reasons, dated July 30th. One, while talking to your office manager, I was led to believe that multiple registered letters were sent out by McGill Associates to notify surrounding residents of their intention to install a irrigation well for Highfields Golf. One letter was received regarding their request before the Board of Health on May 24th, 2025, not by registered mail. The meeting was scheduled for May 5th, 2025, was rescheduled for June 16th, 2025, but was also subsequently canceled. No other letters by registered mail or otherwise were sent regarding a new meeting date on this topic. All the residents living in on Rittenhouse Road were unaware of the meeting ultimately held on July 14th, 2025. Residents are also unaware of the potential impact of the proposed pumping well could have on their water supply and if they would have likely turned out in much greater numbers. 2, the Board of Health should compile a list of residents, including the total number of residents on private wells over a range of concentric distances, include direction from the proposed irrigation well, given the proposed magnitude of pumping and the nature of fractured bedrock flow. I think it would be prudent to collect this information over a distance of at least 2 miles from the well. A greater distance would also be prudent. The exact location of the proposed well has not been shown and would be very useful. Before this proceeds any further, the Board of Health should be aware of how many people could be affected by this pumping well. Number 3, McGill Associates should present the Board of Health a detailed plan of how the pump will be conducted, including installing observation wells, geophysical logging of the pump well and observation wells, how fractured zones will be isolated in the observation well, and how they will be monitored. This information should be made public before proceeding. Number 4, McGill Associates should present a plan on how they would supply water to residents if they cause residential wells to dry during the pump test. Given the proposed depth of the pumping well and the pump rate, it could de-water the bedrock aquifer and cause the shallower residential wells to dry for some time before the aquifer recharges. I assume the Board of Health would disallow the well to be used in the future should this occur and would require McGill Associates to fill the well to prevent future use. So we have this letter on file. Just note that the public hearing has closed. That was held on July 14th. All right. Any other items? Would anyone like to make a motion?
This is Andrew Chulipka. I make a motion to close the meeting.
This is Bill Muller. I second that.
Roll call.
Andrew Chulipka, aye.
Bill Muller, aye.
Karen Wostowski, Govan, aye.
Radhika Prabhu, aye.
Jen Maynard, aye. All right. Thanks, everyone.